Hello everyone, welcome back to the channel. In today's episode, we are going to break down the basics of hair transplant in a simple and practical way. Whether you are a medical student, medical practitioner or someone seeking or requesting for the procedure, this guide will help you to understand the basics, how the hair transplantation works, how we grade the baldness and what measures or practical steps that we take before the surgery. What is hair transplant? Hair transplantation is a minimally invasive procedure where hair grafts or hair follicles is taken out from an area which is safe and which does not fall in time, and it is transplanted back to the area where there is a thinning or baldness. So here comes the science of donor dominance. What do you understand by donor dominance? Donor dominance means the area of the scalp or body where the hairs are not destined to fall. They are genetically programmed not to fall, unlike the hairs in the top or the front of the scalp which falls with time. So donor dominance is the scientific basis for hair transplantation, which means we take out the follicle from the areas which are not destined to fall or which are not going to fall in course of time, and these follicles are transplanted back in the bald areas and therefore they remain with you permanently. Coming to the grades of baldness that the patient comes with, it's mainly divided or graded by Hamilton or Norwood system, which starts with grade 1 and it goes to grade 7, and the stages of hair follicle or loss of hair progresses as we progress from 1 to 7. So mainly the second stage where the temples recession come in, then the fifth stage where the front and the crown baldness has set in with a middle fringe of hair remaining, and 6th and 7th is advanced baldness where whole of the top and vertex and crown area is gone. So as the patient progresses from 1 to 7, the requirement of graft also increases because you need so many number of grafts, because the more number of grafts you have lost. So this has a bearing in the planning and execution for hair transplant procedure. So when a patient coming in early stage, we require a less number of grafts. When a patient comes in the later stage, we require more number of grafts. Then customization is very important, where to put how much and where to give the maximum density. All these points has to be taken into consideration very minutely. Hair transplant techniques are mainly divided into two. One is a FUT technique, another is a FUE technique. FUT technique involves a removal of a strip of scalp from the back of the head, and this strip is then dissected under the microscope on a table, and follicles are individually taken out from the strip, and this follicular graft is then inserted into the bald area. FUE technique means follicular unit extraction. This technique involves using small fine micropunches. These micropunches is used to extract the follicular grafts or units from the back of the scalp, and these follicular units are then transplanted into the recipient area, which is the bald area or a thinned area. Now because this uses only micropunches, the scarring is very minimal. There is a dot like scarring and it avoids the cutting of the scalp, and therefore it is very less invasive and it is becoming more and more acceptable among the common masses. But both the techniques have its own places, and we use the techniques depending on the need where it arises. We are routinely using growth factor concentrate or PRP for storing the grafts, because there is always a intervening time from the graft harvest and the implantation. Even when we are doing direct transplantation, there is a subset of grafts which are staying out of the body for some time. So we have made it a routine that we keep these grafts, whatever numbers small or big, in the solution, so that the graft survival is best and they get the best natural environment to stay. And this growth factor concentrate becomes rich in stem cells because the grafts is stored there, and therefore at the end of the procedure we inject the GFC in the non-transplanted zone to boost up the hair follicles there in that zone. Therefore this GFC has become a very important part of hair transplant procedure nowadays. Candidate selection is very important in hair transplant. You can be a very good candidate, you can be a bad candidate as well. So what do you mean by good candidate? Good candidates for hair transplantation means your hair loss is more or less stabilized and your expectation is not unrealistic. That means you don't expect a fully dense hair in full of your scalp as you had before. Thirdly, you have to accept that because the hair loss is quite significant, the hairline design cannot go back to your 20 years age hairline that you had before. So, these 3 or 4 pointers is very important in understanding whether you are a right good candidate or a poor candidate. Whenever you come for a hair transplantation, we take care of certain factors and we take relevant history, mainly which has a bearing on a procedure, and those important medical conditions that is very important to know before the surgery is you having any epilepsy, hypertension, diabetes, bleeding coagulopathies or any liver or renal problems. So, this has to be taken care of, or the condition has to be stabilized before undergoing or before planning a hair transplant procedure. Smoking history or blood thinners is also very important, and that has to be stopped before the surgery for the best survival of the graft. Similarly, in case you are having severe anxiety or vasovagal episode before, that also needs to be taken care of, so that we can preemptively see that you do not have the same situation in OT and we take care of the same problems if it happens inside the OT. So, these medical conditions and pre-medical drugs or habit forming abuses has to be taken care of before the hair transplant procedure. Whenever I do a hair transplant procedure, planning is paramount. Hair transplant is just not one time procedure, it is a journey that I always tell to the patient, because the hair loss is ongoing. Even if they are delayed, the hair loss will continue to have mainly in the existing hair, not the transplanted, I am talking the existing hair. So, you are in grade 3 or grade 4, you have got a hair transplantation, you might go to grade 6 in due course of time. So, the excess number of graft existing hairs which you have lost in the future course of your life, those graft has to be again transplanted back, because your balding pattern is extending from grade 3 to grade 5. So, you will need 1 or 2 more sessions to fill up the gap that is created in due course of time. So, the hair transplantation is not just one time procedure, it is generally speaking 2 to 3 times in your lifespan that you need, and therefore, planning of this hair transplant becomes very important. In planning, we always use combination of hair grafts. That means we combine scalp and body hair grafts from the first procedure itself, so that in future, in case you have more requirement for grafts in other areas of balding, then we can always combine in a similar way, so that your whole scalp look uniform and not different crops of hair growing in different places. So, this planning is very important to start from session 1, and combination of hair grafts should start from session 1 itself, so that in second session or third session, if you ever get, then you will have again a similar kind of combination. Again, another point is very important. Hair transplant is how do you execute the hair transplantation, mainly the artistic designing, artistic distribution of the graft, so that you optimize the available number of graft to your specific need. So, artistic hairline is very important. Temple triangle formation is very important, because if you do not address the temples, then even if you do a good hairline, you still look a little bald from the side, and that gives a very unnatural look. Very important is the hairline design. It has to be very irregular, it should not be very linear, so that you can make out that somebody has got a transplant. And thirdly, your density pattern should be nicely distributed, so that you optimize the number of graft to the balding area that you have. That means you in the front you will give him better density, as we go back we will loosely pack, so that graft number is nicely utilized. Last but not the least, your whole donor area extraction is very important. We should not over extract from the donor area, so that the donor area become thin and you land up in another problem. and also you don't use bigger size punches so that the scarring is more than what you like to have. So, not over harvesting and use of a minimum punch size, and we use 0.8 millimeter punches so that that gives least amount of scarring in the back and that's not at all visible. To sum it up, hair transplant requires high level of surgical precision and artistry. Hair transplantation also needs thorough planning and execution, and it's just not one day procedure, it's a continuous journey that you are looking for. So, therefore, it has to be a 360-degree view whenever we are handling a specific situation. Thank you.